Skin cancer is by far the most common cancer in Ireland among both men and women. Approximately 5,600 new cases of skin cancer are diagnosed in Ireland every single year. However, it is potentially avoidable. Here to tell us about the risks and symptoms is Dr. Rosemary Coleman. Also joining us is May Quaid, who has survived the disease herself. You're both very welcome. Thanks for coming in, Dr. Rosemary. What is skin cancer?
Well, skin cancer, like other forms of cancer, is where there's an overgrowth of a particular group of cells in the skin, and it's out of control.
Okay. The two types?
The two main types are melanoma skin cancer and non-melanoma.
No, yeah, we hear that all the time.
Yes.
Okay.
So the non-melanoma would be by far the most common, and it's less serious. That would include basal cell cancer.
Okay.
People often know that as a rodent ulcer. And
Let's
that would be the very
picture
common
of it.
type, the tip of his nose.
Did he?
And he got a lot of publicity for that. So there's a basal cell carcinoma with these characteristic rolled borders with visible blood vessels and crusting in the middle.
Okay, now, what age would you see this kind of cancer?
That one happens to be on the face of an elderly gentleman, and so most commonly it would be people in their 50s, 60s upwards, but we can see it in the 20s and 30s, particularly with a lot of sun exposure.
Is it curable?
Yes, totally curable.
That's important
Totally
to
curable. Once it's removed, the earlier you get it, the easier it is to cure, and the less of a scar that's left behind.
Would that be quite itchy, because it looks itchy?
No, not necessarily blunted, no.
And would it be painful, Rosemary?
Usually not,
Okay.
but the marker, what the patient or what the person must look out for is something that's on their skin that's not healing.
Okay.
People will often say, oh, I've had that for a year or two and it keeps bleeding and then it heals up. Well, if it keeps coming back, it's not just a spot. You must go to your doctor.
Yeah, it's funny, you really have to know your skin and your body, don't you, for any of these. Now, the other one, we have another one, I think, beside a woman's eye, a lady's eye, which I think, would that be a typical area?
A very common area. Again, the central panel on the face would be a very common and very dangerous area to get basal cells, because obviously it doesn't matter so much if you've got one down here or on your back. But this young girl, I use this to illustrate a pigmented basal cell on the lower eyelid of a girl in her early 30s.
Early
And
30s.
so it would be quite easy for this to be missed, because you really wouldn't be expecting it. But you can see those rolled borders with the extra blood vessels. So it would be crucial that that is fully removed, because the only time that a basal cell is dangerous to your health is if it's around the eye area and invades the eye area. It can actually travel to the frontal part of the brain. Now, I don't mean to be alarmist, but that's why it's very important to treat them around the eye quite aggressively. That has to be fully removed.
Okay, and it, as you said, a very delicate area as well, so you need to react if you have anything like that.
Absolutely.
You need to do something better immediately. Now, the next one is the, how do you pronounce squamous?
Squamous cell
Squamous
carcinoma.
cell. We're going to look at. Now, the one we're going to look at is on a man's lip. Now, I thought earlier, and I said to you, that I thought that could look like a cold sore.
Well, if that was only there for a week and it healed up and went away, it could well be a cold sore. But if you were to feel this blown, you'd find that it was really quite firm and meaty and there was a lump in it.
Okay.
This wouldn't be quite superficial, and it may be very painless, very asymptomatic, unlike a cold sore. But this person, this was an elderly gentleman, and they would give a history of this growing usually over months to years.
These two that we've been talking about now, are they mostly common on the face? Or is it just coincidence we have pictures of the face?
They're most common on sun-exposed sites, but they can occur anywhere on the body. You could have it on the sole of your foot.
I know, and men should be wearing sunscreen on their lips, not just women, and we do,
Quite
but
right.
the men don't.
Quite
Okay,
right.
the next one we're going to look at, again staying with the same type, is on a man's head, squamous.
Now, these are precancerous, and some of these are probably early cancerous lesions. This would be a very typical appearance of an elderly man's scalp if he hadn't used sun protection. You can see all the irregular pigmentation and freckling and all of these crusty areas, some of which may be tender. But these can form nasty squamous cell carcinomas.
Okay, now men who are bald have to be very vigilant, or do they, I presume?
Very careful, all year round, winter and summer. They hate when I tell them that they really have to wear a hat. And what they have to do is they have to hold the hat up to the sun, and if they can see sunlight through the weave on the hat, the sun can penetrate through to their head. So it must be a tight weave hat, and they should have their sunblock on.
Okay. Now let's look at the melanoma nodular. Is that right?
Okay.
This one is called melanoma nodular. Now, is this one common?
Unfortunately, it's becoming more common. This would be quite a nasty, dangerous skin tumour, because the nodular melanomas often become invasive early, so they grow down into the blood supply, and that can spread in your body, and that unfortunately can lead to death.
Quick reaction is the most important to these.
Absolutely. Again,
okay.
a non-healing area. Nobody should ignore this. It's just a non-healing sore.
Okay, let's look at the common melanoma. We have 3 photographs of this. And is this common?
Yes,
common one?
This would be the most common type of melanoma we see. It's called a superficial spreading melanoma. Now, these are all quite late in that they're large, but it's not rare for one of these to walk in the door, the size of an old 50-pence piece. And you can see that the borders are all what we call scalloped and irregular, and the pigmentation is irregular, so it doesn't look like a nice, even, smooth outline of a mole. These look nasty, and they usually are.
And it's funny, I just noticed the skin colouring of those three people are very different. You're very pink skin, quite sallow. So it doesn't matter what your skin type is like. You could get these.
Anyone, even people with black skin can get a melanoma. It's just less common. But with our Irish skin, which is type 1 and 2, we burn and tan. We burn very easily. The trouble is we can often tan, so we keep burning to tan. They're the most dangerous skin types.
No, we hadn't a clue 20 years ago, did we?
No.
We really hadn't a clue.
No.
Now, lentigo is the next one. Am I pronouncing that properly?
So that's a lentigo maligna,
Lentigo.
which would be very common on the head and neck of elderly people. So
now, I have seen people with that.
Right,
I never know what it was.
Yeah. Well, there you go. This can lead to a melanoma. It wouldn't be quite as serious as the nodular melanoma, but it can become a problem. It does need to be treated and removed.
Okay, let's look at just a harmless mole, because we don't want to freak anyone out watching this, but at the same time we need to be more vigilant, and we're not.
Okay, well, what this actually is, Blonde, it's not actually a mole. It's what we call a seborrheic keratosis. So that's an aging wart, which is very common on the trunk of elderly people. It's an aging wart or a seborrheic keratosis. It looks nasty because it's pigmented, but it has no malignant potential.
Okay, all right.
So nobody should panic if they're covered in those.
No, I know, but at the same time you should get everything checked out.
Well, you should, because in Australia they found that the incidence of melanoma went down in all age groups except elderly men, where they had many of these, and therefore they didn't get them checked out, and then the melanoma was hiding in there.
You said something very interesting to me earlier. If a 10-year-old child was to leave Australia, say, today, and move to a different country, they still hold the potential of getting Australian cancer, skin cancer.
They hold the risk that is carried in the Australian population. So it's the amount of sun you get below the age of 10, where our immune system is more immature and it doesn't handle mutations as well, that does determine your lifetime risk.
Incredible.
Although that being said, it's never too soon to stop getting the sun.
Absolutely.
Even at the age of 70 you can reduce your risk of skin cancer.
May, thank you very much for coming in. You're feeling good now? You're in good form?
I'm great, thank you.
Tell me what happened to you. Was it around your face area?
Initially, yes. My forehead and around my nose area and whatever.
Now, what kind of skin cancer did you have around your nose?
I'll have to ask Rose.
Okay, what May had was, she had actinic keratosis. Do you remember that bald man's head?
Well, there is actually May's there.
This was May's face at first, so she had a lot of these irregular, blotchy, red, scaly marks, which we can see on her cheeks and nose. They were all over her forehead. And if they hadn't been treated, she would have ended up like that bald man's head with skin cancers and nasty bumps.
So what kind of treatment did you have, May?
Initially, you used the liquid nitrogen, and you know they sort of came up and fell out. Yes, and then Rosemary recommended the other treatment.
So you didn't have? Do you have anything invasive? Did you have any sort of therapy, a radiation or anything like that?
My leg.
May also had a skin cancer on her leg, which we had to remove surgically. So that was a basal cell cancer, whereas what she had in her face were actinic keratoses. They were pre-squamous cell.
May, why do you think you got it?
Well, I suppose years ago nobody ever thought about putting on protection. I play golf. I'd be 4 hours on a golf course with my face up at the sun every chance I got, or when I was on continental holidays. Never occurred to me that I'd be doing,
That's the thing, it didn't
harm
occur
to myself.
Yeah.
It wasn't. I went to Rosemary initially, I think, in 1999.
Did you get a fright?
Yes. Well, my own GP told me that that was what was wrong with me, and he recommended Rosemary, and that's where I went. And she's been very good to me.
Hence your beautiful face.
I wouldn't say it's beautiful, but the mess
you are very beautiful. And tell me this, now how things changed for you, you know, how careful are you now?
Oh, I'm very careful.
Yeah.
Very, very careful.
Unfortunately, it takes a little fright sometimes, doesn't it?
My leg frightened me more than my face, I have to say. But,
what would have happened to the leg if it was ignored?
An ulcer. She would have just got a larger and larger painful ulcer, which could have potentially gone down into the bone. Now, it rarely will unless it's neglected, but it would end up nasty.
Okay, you're very, very lucky. Now, it's very important, and I wanted plenty of time to talk about these skin factors, sun factors, protect, protect, protect. From the moment we're born to the moment we're buried, we need to be using this constantly, isn't that right?
We do with our skin type, yes.
Now, we're looking at very high factors here. Do they have to be this high, Rosemary?
Well, I think my feeling is certainly that throughout the winter we really should just use a factor 30 all day, every day. Get a moisturiser with a factor 30 or use one of the blocks. I think the important thing is to be aware of the very wide range that's available. It doesn't matter what the brand is, your type of skin, and for men it mustn't be white and shiny and greasy or they won't put it on.
Of course.
So once you find one that you like, use it. So in the winter I would recommend from one end of the winter to the other use a 30, but in the summer I would recommend stepping up to a 50, but certainly for any sort of sporting activities or outdoor golf, skiing,
Absolutely.
sailing, walking, etc.
So don't forget the face, obviously the face, the neck and the lips, and some people forget their neck and their lips. Thank you so much for coming in.